Welcome to the Good Health Revolution, South Africa's largest ever online health and wellness event, where we have brought together the country's leading experts who will reveal powerful strategies with you on how you can improve your health and create a life of energy and vitality, starting today. Health and healing does not have to be difficult, restrictive, or even overwhelming. We are going to show you how fun, easy, and effective it can really be. All you need is the right guidance, accountability, an open mind, and an attitude of curiosity. Don't forget, if you would like to own this entire series to share with your family and friends, as well as get your hands on a variety of resources that will support you in a big way to reach your health goals, just click the VIP upgrade button on your screen to get access. So are you ready to create a life your future self will thank you for? Let's get started. Enjoy the show. Hey, and welcome back to the Good Health Revolution. I'm your host, Stephanie Grosvenor, owner of Unlimited You Coaching and co-founder of Vitamin G Nutraceuticals. I am so honored to be able to welcome back to the show, Dr. Farial Luha. Dr. Farial, thank you so much for being with us once again and offering up your time so generously for a second time on the event.
It's absolutely my pleasure. I'm really delighted to be here again. Thank you, Stephanie.
So today the first conversation that we had, if you guys haven't watched it, I encourage you to go back. We were discussing Hashimoto's and all kinds of thyroid issues, which are plaguing so many women at the moment. So if you haven't watched that, please go back and take a look. Today, we are still going to stay on slightly the topic of hormones, but shifting more into a condition called PCOS, Polycystic Ovarian Syndrome, which is something that we are seeing more and more women developing, unfortunately. But before we get into all the good stuff, I'm quickly going to read off your bio for those of you who maybe did not catch our first discussion, and then we can get started.
Sounds great.
With a passion for the body's innate healing power and the integration of naturopathic medicines and therapies, Farial offers patients comprehensive naturopathic medical care and education to optimize their health and well-being. Using a holistic approach, Farial strives to uncover the root cause of disease through clinical experience and the use of innovative laboratory assessments. Treatment plans are tailor-made to suit each individual's specific needs and goals while supporting the individual's inherent capacity to self-heal. Treatment modalities incorporate functional medicine approaches and include clinical nutrition, botanical medicines, Chinese medicine, acupuncture and cupping, supplementation, and lifestyle counseling. Dr. Farial has a focus on women's health. However, she treats a wide range of conditions from chronic pain such as migraines and chronic disease such as diabetes. Dr. Farial graduated from the Canadian College of Naturopathic Medicine. She has been in practice for a combined 17 years, starting initially in Canada, and currently splits her practice between South Africa and Dubai. She aims to empower and educate her patients to take charge of their health by living a happy, balanced life full of variety and possibility. Isn't that beautiful?
Well, it's something that I think all of us should be able to do. And I'm really hoping that naturopathic medicine in particular is one of these modalities that many, many people can access. So thank you also for this platform and for everything that you're doing to, spread the word.
Of course, it's such an honor and a pleasure. It's a gift to be able to do these things. So I'm so grateful to it. And it wouldn't be possible without having people such as yourself and the variety of other experts on the show. It wouldn't be possible without you all coming together to support this mission. So thank you so much. As mentioned, we are going to be jumping into PCOS, Polycystic Ovarian Syndrome. Let's start off by just discussing what PCOS is.
So it's quite a complex, multifactorial, multifaceted disorder. And hopefully in this conversation, not only will we talk about the what, but also the why, because that's really, really important. And from a naturopathic perspective, we always want to look at where is this coming from? What are the driving factors? Because that informs treatment. But with PCOS, if I can start off by saying first of all, it's a bit of a misnomer, the actual term PCOS, because it stands for Polycystic Ovarian Syndrome. And I'll get into why I think that, but mostly it's because this condition, when it affects women differently. It is on a spectrum. It's a range and a cluster of various symptoms. So oftentimes, Stephanie, when I have women presenting into the clinic, they don't even know that they have PCOS. And you'll hear me say PCOS, which also is PCOS.
Yeah.
If you hear me saying that, that's what I mean. And oftentimes they're presenting with symptoms such as, missed periods or prolonged periods, all these irregularities. They're just experiencing these really funky periods, right? So that's the first thing that comes in. Or they're coming in because of infertility. They're having difficulty getting pregnant and they don't understand why. Or they're coming in because they're experiencing a lot of acne or hair growth in undesirable places, but at the same time, they're losing hair on the head. And so, both of us being women, that, skin, hair, these are like big deals for us, right? That's usually what brings people in. And it's not until we do some sort of workup using functional lab tests and obviously looking at things clinically that we then discover that the woman has PCOS. But like I said, it could be a variety of different symptoms. You've got women who have very, very distressing, quite, serious, if I can use that word, symptoms, because there are some risk factors. A lot of women who have PCOS, if it's not properly treated, they can end up having higher risk for cardiovascular disease, diabetes, and many other chronic diseases. So it's got to be properly treated. And this is part of the problem.
It can put you at quite high risk for cancers.
Yes, you're absolutely right. Yeah, and so if it's not properly treated, this is the direction potentially they can go in. And then you've got women who have very mild symptoms. Another interesting thing is that we also associate, or in the past associated, PCOS with women who were obese or overweight, particularly with the abdominal adiposity, meaning the sort of belly fat, and it's that apple shape. So they've got like the skinny legs, but the abdomen is a little bit bigger. That used to be the typical picture, but now more often we're finding women who are actually slim, right, who are also experiencing PCOS. So as I said, it's a cluster. And this is why it's also a bit of a misnomer, because it's affecting different organ systems. It's not just the ovaries.
Very true, very, very true. And I agree with you completely. Like it's no longer, I don't think that term is appropriate anymore. So what I'm hearing from you is there's a variety of different signs and symptoms that people can look out for. And most of the time, in your experience, when you are seeing clients that have PCOS, when they initially come in, they don't know that this is what they're dealing with. They're coming in with these different signs and symptoms, trying to figure out why. And when you do the testing and you look into it, it comes out that they are then dealing with PCOS.
Yeah, so this is the typical picture. I will add, however, that there are many women who know. They believe they've been given a diagnosis of PCOS. They've gone and seen about 3 or 4 doctors. And this is what is so disheartening, because they'll finally end up in my office and I will say to them, well, how was the diagnosis made? And we'll get into a little bit more about the diagnostics, but they'll basically say, well, the doctor looked at an ultrasound on ovaries and found these cysts and basically said, I have PCOS. And I will ask them, okay, so then what was the advice? Well, basically they either have asked them to go on the birth control pill, or they've told them to lose weight, but there's no other guidance. And so it's devastating, because a lot of these women are also being told by their doctors that if they don't go on the birth control pill, they will have a very difficult time getting pregnant.
Yeah.
Right. So on the flip side, we have people coming in who have a sense that they have PCOS, but that diagnosis was either not made correctly, or it was the sort of advice given doesn't really help them in terms of, well, how do I deal with this? And the criteria for being able to diagnose PCOS is very interesting, because believe it or not, Stephanie, now we have a consensus where we don't even need to see cysts on ovaries to make that diagnosis, which is what the actual syndrome is based upon, because many, many women of childbearing age, reproductive age, will have cysts on their ovaries at some point, which will self-resolve.
Yes. Oh, completely, 100%. And what I've noticed in my experience is the majority of the women that I've spoken to who have PCOS, it is heartbreaking because they come to me in tears that they now are no longer able to have children because they were diagnosed with PCOS. It's a very heartbreaking situation for them when they go to their doctor's office and this is what they're being told. And that is not the case. You can 100% get rid of the PCOS. You can, of course, still conceive in a very healthy, very natural way when we take care of this. And it breaks my heart when I'm looking at these women who have been told that, you know, they go in already feeling awful because of all these symptoms that they're having. Now they're getting a diagnosis and told to get on chronic medication, and they're being told their likelihood of having children is very, very, very low. Like that is, it's heartbreaking for women.
Absolutely. Absolutely. It's devastating. And it's also for me as a doctor, quite upsetting because these women they've now gotten a second, a third, and a fourth opinion, and it can take a couple of years to resolve this condition. So in the meantime, they are going deeper and deeper into the condition.
Yes, completely. So that all ends today, because we are going to set the record straight and give some different advice to women on how to deal with PCOS. But before we get into the treatment and testing, because we see this condition on the rise, what are some of the root causes or the main drivers of developing PCOS?
That's a great question. So we do have several drivers, which is why the symptoms can be so variable from one woman to another. Primarily, the main driving forces are going to be hormonal. So when we're looking at PCOS, there are a couple of things here. First of all, most often we'll see women who have insulin resistance or blood sugar dysregulation issues, okay? So that insulin that is circulating in their bloodstream is higher than it should be. And when we have too much insulin in the body, it actually creates issues with respect to the reproductive hormones and ovulation. So remember that one of the things that is important when we're looking at PCOS is the irregularities with respect to the menstrual cycle. And I just want to point out here that many, many women can have a period monthly. They can have regular periods, but that doesn't necessarily mean that they're ovulating. So the release of the egg is not happening. And why is that? Because we have what we call follicles in our ovaries. These are immature eggs that are going to eventually mature from a follicle into an egg. And then every month, there's a cascade of reactions that takes place to allow one of those eggs to be released from the ovary into the fallopian tube. And I think everybody else knows, how the rest of it works. And of course, if that egg is not fertilized, then you get your period. Yes. But this is what's happening in PCOS, is that we're having these, what we call anovulatory cycles. They're having a period, even if it's irregular, but they're not necessarily ovulating. So that's key. And insulin, when it's high, impacts the ability for that follicle to mature into an egg that can be released. So that's one thing. The other thing about insulin is it's obviously going to impact, blood sugar regulation. And this is where we can get the weight gain, the difficulty with losing weight, no matter how hard they're trying. And there are a bunch of other things, but another interesting hormone that's also impacted here is what we call the androgens. So these are primarily the male hormones, testosterone and DHEA. And if those are high, then that can also create a lot of symptoms where we get the acne and the alopecia, meaning the hair fall or the hair thinning on the scalp, and then hair growth along the jawline or on the chest, around the nipples, around the belly, in places where women obviously don't want that hair growth. So that's more of an androgen-driven PCOS. But interestingly, insulin will actually cause testosterone levels to increase. So oftentimes you can find women who have both. They may have a more insulin resistance-driven PCOS or an androgen-driven PCOS or a combination. Mm-hmm. And then thirdly, what's interesting is we have a lot of women who present with the same symptoms. It's after having taken the birth control pill for a number of years and have now stopped. And it's called post-pill PCOS. So typically it is temporary, it should be, but for some women, it will continue on and create many symptoms. And again, the issue here is that when a woman is taking a birth control pill, unfortunately, the period that they're experiencing is not a natural period, right? It's an artificial bleed. And that's not actually their natural body's way of having a period. So when I see women like this, I need to see, well, what is the body doing naturally after the period, to be able to assess if there's an imbalance now from the withdrawal of the pill hormonally that's causing this PCOS.
Yes.
So those are the hormonal ones. Then we have some other factors that are not necessarily hormonal, but they do impact our hormones.
Can I jump in here for a sec? Just maybe you're even getting to this, but just talking about hormones, I wanted to bring in the fact of, or the aspect of estrogen dominance and how that can play a role in PCOS as well, correct?
Absolutely, because estrogen, first of all, thank you for bringing that up, is a hormone that we associate with being something that's very stimulating. So it makes things grow, it's more of an arousal hormone. It's a very stimulatory hormone. And if we have too much estrogen circulating the system, in particular, we have a specific type of estrogen because women do make 3 different types of estrogens. If they're being metabolized and then they're not leaving the system after they've been used in a safe and harmless manner, you will get this estrogen recirculating into the system, causing these symptoms. And because I said it's something that helps cells grow, you can even experience things like fibroids, of course, the cysts on the ovaries, all the way to breast tissue enlargement, tumors, that sort of thing. So certainly something to look at. And when I am, presented with a woman who is experiencing these symptoms, we do a full hormonal workup, because often it's not just one thing that's happening. There could be a multiple, several different things happening at the same time that are all kind of interconnected. But what's interesting about estrogen is we have an enzyme called aromatase that converts estrogen into testosterone. So if there's too much estrogen circulating the system, it's very possible that it's being also converted into testosterone. Vice versa, testosterone can also be converted into estrogen. So that's another point to look at.
Definitely. And I love that you do this full hormonal panel. And just on that note, and I guess this is a whole nother conversation, but just to reiterate for people, or to remind you that because your estrogen, your progesterone, this all fluctuates throughout the month. Going and getting tested at any time or day of the month is not going to be very supportive, because your levels might come back really low or really high, and that's not a true result. You need to know where in your cycle you are, and then time your blood test or your blood work around your cycle. And that's something that you ask your doctor. There's some research online you can figure out. You can email me or Dr. Fariel, and we can support you on when to really get these blood tests done. But it's just something to know that your levels will fluctuate throughout the month, and that will obviously affect your blood test. So just be aware of that when you are doing these panels. Okay, so we've got estrogen dominance, we've got insulin resistance, we've got high testosterone levels, all these sort of hormonal issues that can lead to PCOS. What were the other factors that you wanted to mention that could increase or could lead to the development of PCOS?
So I'd like to just, it's a nice segue with what you brought up with estrogen, because we have, unfortunately, we're being bombarded with chemicals all around us that are called endocrine disrupting chemicals, EDCs, right? And so these are in our personal care products, in our makeup, in our house cleaning products. They're just in the air with pollution and so on, plastics and so on. So that's very, very important, because what's been found, so worldwide, we're looking at about 10 to 15% of women worldwide who have been properly diagnosed with PCOS. That's the prevalence, okay? What's been found to be very interesting, though, is that a high percentage of those women in their blood are finding high levels of BPA, bisphenol A, which is coming from plastic bottles, right? And there was an expert a long time ago who actually mentioned, and I don't remember his name, but he actually mentioned that young girls drinking out of plastic bottles are going to be more prone to developing PCOS. And this was years ago. So it's very important to consider these chemicals that are leaching into our systems, whether it's from the plastics, and the worst, which is still happening to this day, is microwaving food in plastic containers.
Plastic. I know. I was just thinking about that. It breaks my heart when I see that. And even if I do go to like Woolies or something and I buy a pre-made meal, then it says like pierce the film and put it in the microwave. Don't pierce the film. I don't want to be buying a lot of those meals, but sometimes on occasion when I do, it's bringing home, putting it into a different container or heating it up on the stove. You do not want to be heating plastic in a microwave. Please, you wherever possible, we shouldn't even be buying food that is in a plastic container, because it does leach into the food. But if you find yourself doing this, we all do it. It's convenient food sometimes. Do not heat it in a microwave. Please, 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 please.
Right, absolutely. So what you're doing is what many of us have to resort to do with, if you're getting takeaways, is to remove it immediately if you can from the plastic container and put it into something else, a ceramic or a glass casserole or something like that. Here, unfortunately, in this part of the region where I am in the Middle East, this is still rife. And, you know, it's incredible because we've gotten to the point where we're taking our containers to some of the outlets that we buy food from sometimes, and we're asking them to please automatically put the food into our containers, not into theirs, right? Until we can really get people understanding. And, you know, with the plastics and styrofoam, and these are all chemicals that are, once they're heated by the heat temperature of the food, they're leaching into the food. So the reason I want to bring that up is because it's something that is affecting not only the estrogen levels and creating a whole mayhem in the system with reproductive hormones, because it's mimicking what our natural estrogen would do, but it's actually dangerous. That's one thing. Excuse me. The other issue is that it is creating issues with our gut health. And gut health is another driving force when it comes to speaking about PCOS or any hormonal imbalance, really. We have what we call the microbiome, which we've spoken about before. And this is the, you know, ecology or the ecosystem of all the beautiful, friendly, diverse, healthy bacteria that are supposed to reside in our gut to help us extract nutrients, to help us with respect to our immune function. And they're very, very involved with hormonal imbalance or balance, because there is an enzyme called beta glucuronidase. That enzyme helps with getting the bad estrogens out of the system. Once that enzyme is impacted, unfortunately, through eating foods that are laden with chemicals, too many sugary foods, we're having an imbalance of the microbiome with the unhealthy, you know, potentially health-causing bacteria residing in the gut. That's going to impact this enzyme, and we're going to have more estrogen than, rather than leaving the system, staying in the system. And then we also get leaky gut, right? So breaches in the intestinal lining that can create problems. And again, studies show us over and over again that women who have PCOS, their microbiomes are less diverse, and they actually have bacteria that are less of the healthier populations. So very, very important to look at this and how whatever we're putting into the body is impacting our gut health. And toilet habits. Again, are we going to the toilet regularly to be able to get rid of these toxins? So that's one factor. Of course, all of this is going to also then lead to one of the other driving forces, which is inflammation. So if we've got a low-grade inflammation going on in the system, that's also going to start creating imbalances with how our hormones are working together. And that can be another result of the cysts on the ovaries if we're using that as one of the criteria and the imbalance in the hormones.
Amazing, amazing. Thank you for that. So to really just summarize, when we're looking at the root cause or the drivers, you've got your various hormonal drivers, your higher estrogen, insulin resistance is a big one, higher testosterone. You want to be looking at your gut health, because gut dysbiosis, leaky gut, could be leading to PCOS, inflammation, and then your post-pill PCOS.
Those would be the main ones, you know. And what's interesting is that we are also finding that the women who are most affected by PCOS in the world live in industrialized nations.
I can believe
so. Certainly, the connection is there, right? Because we're exposed to more pollution. There's a lot more in terms of chemicals that we're taking into our homes and into our systems, like you said, for the sake of convenience. So it makes sense, right? We're not necessarily eating, you know, from the earth. It's a lot of processed foods. All of these things are going to impact our reproductive health.
Definitely, definitely. So whatever you can do, and we're going to get into treatment now, but always looking at those factors. What are my inflammation levels at? What can I do to decrease my inflammation? And this is something whether you know what your driving factor was or not. These sort of things that you can look at are going to promote better health in any way. So regardless of what your factor could be, and as you mentioned, it's not always one thing, it's likely a couple factors that are playing in. You want to make sure you're doing whatever you can to decrease inflammation, to decrease the toxins in your environment, and make sure your detoxification system is working correctly in conjunction with your gut, so that you can eliminate these excess estrogens from your body. And then, of course, you want to be looking at your gut health as well, and making sure that that's in a good state, so we can minimize the risk of developing PCOS, as well as help to manage it if you are diagnosed. But on that note, let's talk a little bit more about what people can do to heal their body from a condition like this. When we're looking at conventional medicine, you mentioned in the beginning, the answer from a conventional perspective is to go onto the pill or to get onto something called metformin, which we know a lot of people use for PCOS, for diabetes, for a range of different conditions. And that's not really the answer. So if that's how conventional medicine is really approaching it at this moment, how does it look different when we approach it from a functional or integrative or naturopathic approach?
So the issue with conventional medicine is it's largely symptom-based, right? And the way that, conventional medicine approaches health or disease is giving a pill for every ill. Let's just be honest, right? And that's not necessarily the best approach, because the medications given, whether it's metformin, whether it's the birth control pill, like I said, that's what most women are being offered as a treatment when they come in with PCOS, whether it's something to help with the acne, again, the pill is advised here, or something like Accutane. I mean, there's a reason that Accutane is only advised to be taken for 6 months or less. There's a reason behind it, right? And it's because of the toxic effects on the body, and in particular, the liver. So these things are treating aspects or the symptoms of the condition, but they're not looking at the why. They're not looking at, well, where is this coming from? What is the root cause? What is driving this? I must mention one of the factors is, of course, genetics, which I didn't mention before. So we do know that women who have a sister or whose mother had polycystic ovarian syndrome have a higher prevalence of developing the same. That's not to say that, of course, if you have genetically higher prevalence, that you will develop it. Of course not, but it's just something to consider. Yeah. So conventional medicine, unfortunately, besides not looking at the root cause, these, whatever they're offering in terms of medications, drugs, are chemicals. So they're going to increase the toxic burden in the system. On top of that, we have issues already, probably with detoxification with many of these women, or gut health, like I said. And the other issue is that when we're introducing chemicals into the body, we are going to inadvertently create situations where there are going to be nutrient deficiencies. So for example, metformin robs the body of B12. Okay, there are other drugs, even the birth control pill, that robs the body of things like zinc and magnesium. And these are critical nutrients, so vital when it comes to helping women to achieve, good, healthy, reproductive wellness. So those are all the issues from a naturopathic point of view. Yes.
I'm so sorry. Just on that point of metformin and how it can also lead to nutrient deficiencies, we know with PCOS, your detoxification system can be compromised. And what a lot of people don't realize is the damage that metformin can do to your liver. And this is why some doctors, not many, but some doctors I've come across, when they prescribe metformin, they actually prescribe milk thistle as well to help support the liver. But that's very far and few between that a doctor will actually say something like that to you. And if you are taking something like metformin, you need to be on a liver support supplement, because it damages your liver. It's not just depleting nutrients. So now you're on metformin, it's interfering with the detoxification system, which is just increasing the estrogen and that hormonal imbalance. So it's a vicious cycle that we're not fixing anything. We're just aggravating a problem and trying to put a band-aid on the symptoms.
Correct. Look, I'm going to be honest, when it comes to metformin, there is some science also in its favor as one of these really powerful anti-aging. They're looking at it as a preventive cancer drug. So, there's a lot of controversy around it because also if you're breastfeeding, you're pregnant, you shouldn't be taking metformin. There have been studies showing that the fetus has a higher prevalence of becoming obese if a woman's on metformin, right? Pre-pregnancy or during pregnancy. So all of these things need to be looked at. And if it's very, very short term until we can get them onto a functional or naturopathic approach, sometimes that needs to happen. But long term, chronic use of these drugs have certain widespread effects. And as you rightly said, they're more of a band-aid. So when it comes to the approach that I would offer, for example, of course, we're looking at root cause, which starts with testing. And it's very important to do a proper hormonal workup, as you said, specific days of the cycle, because we have different hormones that are dominant during the first phase compared to the second phase of our cycles. We also need to look at the androgens. We need to look at, I always do a full blood sugar panel, which will involve your fasting blood sugar, but also HbA1c, fasting insulin, which a lot of doctors will not order. And it's one of the first things to rise, not just with PCOS, but even with diabetes, pre-diabetes. It's one of the first things to go awry before even the blood sugar levels become elevated. I also look at a full cholesterol panel, liver function, kidney function, because as you said, if the liver is being affected, the liver is what's responsible also for our cholesterol metabolism. So we will find women also starting to have aberrations in their cholesterol panel. And then, sometimes I will add, of course, I'm looking at other nutrients, vitamin D, magnesium, B12, folate. These are all things we need to look at. Very, very important. I will also potentially look at an organic acids or a heavy metal testing, or if I need to do stool testing. So, there are a variety of different tests to get a broader picture of what's happening. And then based on what it is it insulin driven? If it's insulin driven, we're going to focus, right? We're going to focus treatment on that. If it's androgen driven, I'm going to be dealing more with the adrenals and trying to balance hormones. And I do this using plant-based natural medicines, which I can get into if you like, and a lot of lifestyle interventions. If it's a combination of both, then we have to do both. So those are some of the things that we look at from a naturopathic point of view, but also lifestyle, looking at stress. All of these things are important.
And movement for women who are dealing with PCOS. I mean, exercise, movement's important for everybody for overall health, but I find particularly with PCOS, it's very important because it helps to regulate those hormones. It helps with estrogen sensitivity, decreasing estrogen dominance, assisting with inflammation and your detoxification system, just getting those things out your body. So movement's definitely something we want to look at if you are dealing with PCOS.
I'd just like to say on that point, though, Stephanie, which is a great point, when it comes to movement, especially for PCOS women, depending on where they are, on that spectrum, I don't advocate things like high intensity interval training right off the bat. That is not necessarily the best place to start, especially if they are overweight and obese, because we're just putting more pressure on the system and on the joints and on the heart. And remember, exercise is a stressor. The moment you exercise, you're creating stress in the body. Cortisol levels are going to shoot up. And that, again, there's a crosstalk between stress hormones and your reproductive hormones. So we got to think about that. Having said that, doing something as simple as walking. Walking is great, 15, 20 minutes or longer if you can. Half an hour would be great every single day. Not only because, as you said, it's going to bring down insulin. So one of my tips is usually to say to women, try and have your dinner earlier and then go for a walk after dinner, because right away you're going to be using that insulin that's been released into the system in trying to digest your carbs to the muscles to help you use it up. That's one thing. It also seems to improve bowel movements. When women are walking, they are reporting more regular bowel movements. The other thing is it's really de-stressing. If you're walking in nature, if you're walking on the beach, if you're walking somewhere where there are, the sounds of nature and the birds and the flowers and fresh air, these things really are a buffer against stress and bring that inflammation down. So I usually like to opt for things that are, a little bit low intensity, like walking, yoga, qigong, dancing, but not high intensity, not right away. I also wanted to say on that note with diet, another approach that is often being used for women with hormonal imbalances is the keto diet, right? And keto diet is great for different conditions. With PCOS, it is not the diet that I would recommend. We want to go for low carb, high protein, good quality protein, lots of fiber to feed that microbiome. What's interesting though is that carbohydrates, complex carbs, are needed in order for ovulation to happen.
Yes. Yes.
Okay. So yes, we want to include healthy fats, but going into a very strict keto, which I don't think is sustainable, really. I prefer women do more of the Mediterranean style of eating, or even paleo. Those would be a little bit more sustainable, and you're getting all the nutrients you need without removing a whole group of foods, and hopefully eating lots of good quality produce. Remember, those endocrine disruptors, it's got to be organic, no pesticides, no herbicides, no hormones, right? All these things.
Amazing. And I'm so happy you mentioned that about keto, and that it's not necessarily the answer for everything, because I know there's a massive keto trend not at the moment, like it's been going for many years. And I 100% advocate for a high protein, high like healthy fat and a low carb way of eating. So like you said, paleo, maybe slightly towards Mediterranean. But going full keto is not necessarily the answer. And what I focus on a lot with people, and this is really helpful for women with PCOS, is working on your metabolic flexibility. It is not only great for your hormones, but it's something that we know is really beneficial to increase your longevity and increase your health span. And when we are going full keto, we're not working on that flexibility. You become very fat adapted, but you are not able to easily jump between burning fats and burning carbs. But when you can work on your metabolic flexibility, and your body is able to choose which one it's going to burn, when it comes in, you just see your health benefits are incredible from that. You're not only burning one or the other. And by working on this metabolic flexibility, by looking more paleo or Mediterranean, you're not eliminating a lot of the healthy foods that people tend to eliminate on keto, because there's this of fruits and veggies on keto, and you need it. You need those phytonutrients from your different fruits and vegetables. You need that fiber. So I think, opting for a more paleo or Mediterranean style diet is beneficial. But again, it's not one size fits all. It depends what you're dealing with.
Of course, it certainly depends, And again, if women want to do keto, I'm not against it, as long as it's short term, maybe to achieve something initially, but it's just not sustainable for all the reasons we discussed. And I think another really key factor to keep in mind here is we're dealing with women's physiology. It is different from a man's physiology. Our reproductive cycles work on something called the infradian rhythm. You've all heard of the circadian rhythm. We also, as women, have something called the infradian rhythm, which is really intimately linked to our reproductive hormone fluctuations, our periods. It's also linked to the cycle of the moon, right? So ideally, women should be having their periods every 28 days. Of course, it's not going to be the case for every woman. But these are things that are linked to the infradian rhythm. And so what's interesting is that leading up to ovulation, our exercise regimen, the way we sleep, how long we sleep, what we're taking in for food changes. Those needs change. Yes. And they change again after menstruation, because the body's doing different things. We have a building up phase, and then we have a releasing, detoxing phase. Yes. One of the gifts as women, which I'd really like to hopefully empower women to appreciate this, is that we're so lucky that we get a period, because it's one of the only extra ways in which we can detox.
Yeah. You're so right. And I remember, or just on that fact of infradian rhythm, we do have an interview all around that, and how you can start to sync your cycle, sync your lifestyle, and do the cycle syncing. It's with Daniela Porter. So make sure you guys take a look out for that. Every single woman needs to watch that interview and understand this, because very few of us actually live by our infradian rhythm, and it is a game changer. And there was something else I was going to say now on top of what you were saying, and I've completely forgotten. But anyway.
I'm sure it'll come back. But I just wanted to mention about the physiology uniqueness that we experience as women. And so with the keto, you cannot be eating the same way all through your cycle. You need to think about that.
Definitely. No.
Right. And all our hormones are coming from healthy fats. Yes.
Yeah.
But I think there's also the whole concept of dirty keto, versus clean keto. That also needs to be distinguished.
Yes. Keto diet does not mean you get to eat all the bacon, butter, and biltong and all the stuff that you want. It gets to be balanced as well.
Correct.
What I was going to say, I remember now, I mean, you said how blessed we are as women and how fortunate we are to have a period. You know, a lot of our health comes down to our mental state as well, and our self-talk and you know, how we view our bodies, how we talk to ourselves. And I remember for so many years, particularly when I was a teenager and early 20s, every single time, every month when I got my period, I was like, oh my gosh, like I always call it lady time. And I'm like, why do I have to have lady time right now? It's so inconvenient. What like it was an annoyance. And now it's completely different. Every single time in the month when lady time comes around, I'm so grateful. I literally hug my body and I'm like, thank you so much, because it means that my body is working properly. It's
correct.
working as it should.
Yes.
This is the natural cycle, and I'm so grateful every single time it happens. I get this immense gratitude in me that doesn't happen in other ways, and I'm just so grateful that I can experience this. It is a blessing.
Yes.
A lot of women who are dealing with infertility and irregular periods and all the health issues that come with that, and I would never wish that on anybody, and I'm so grateful that I don't have that problem. So I'm sharing this because I want as women to understand what a blessing your period is, and to change the way you view it and the way that you speak to yourself and your body when these happen, because our words are powerful. Our words are important.
Yes, I completely agree with you. And I'm hoping that, you know, as we go along, we can start teaching our girls in school from the time of school about exactly what you said about embracing this time every month in our lives. I mean, there's many cultures, you know, I'm Canadian, so I am also very much fascinated by the, you know, First Nations, Native Indian cultures in Canada. And for them, when a woman gets their period, it's called the moon time, which is really beautiful. But it's also a time of complete rest. They're not allowed to do any work at all. They're not allowed to cook. They're supposed to just be with themselves. It's a time of self-reflection. You know, so I just think that we already have cultures in the world, I'm sure, that really do celebrate this with girls. It's obviously a rite of passage when they get it the first time. But I think that in Western cultures, it's kind of looked upon as a nuisance, as something that's just getting in the way of life. It's irritating. Another thing, I know this is off topic, but I think that it's really important for women to be able to have the permission also that if they're having really difficult periods, painful periods that are debilitating to the point that they can't get to work, first of all, that's not normal, right? It is not normal to have a painful period. Let me just say that, okay? Yeah. Having said that, I think our bosses, especially if they're men, need to be sensitive to that, because a lot of women don't want to call in and say, I'm not feeling well today because it's day one of my period. Yes. There's like a stigma attached to that, and it shouldn't be. So let's hope with all these conversations, you know, we're going to start getting women and girls and people in general to appreciate that this is part of our experience as a woman, and it should actually be embraced and celebrated.
Oh, definitely. And I really encourage you guys to check out the Cycle Syncing interview as well, where we're going to talk a little bit more about what, like, in terms of work, in terms of relationships, in terms of food and movement, how we can start to shift this throughout our cycle. But Dr. Farrell, it's been fantastic to speak with you. PCOS is something that is so important for me to highlight. And I really appreciate you coming on and sharing your knowledge and expertise with us. I really hope this has been super supportive for everybody who's watching. If you have more questions about PCOS, please reach out to Dr. Farrell, reach out to me, reach out to somebody, because it is not a sentence. It is not a forever condition. It is not something, just because you have it doesn't mean that you have to struggle to have children, doesn't mean you have to struggle with your weight and your moods and all these horrible things that we experience with PCOS. So please, there's so much that you can do, and I hope that you feel empowered and hopeful after watching this. Between myself and Dr. Farrell, we have seen hundreds of women overcome PCOS and get their bodies back, get their easily be able to have children. This is a normal thing when you do it correctly. So please make sure that you do whatever you need to support your body. This is not something that you need to live with forever. So Dr. Farrell, thank you so much for your time today. It's always such a treat to speak with you.
Yeah, I really enjoyed the session. Thanks so much.
We hope you enjoyed our discussion. Don't forget,
It is not knowledge that is power. It is what you do with your newfound knowledge that really makes the difference. So act now and start to implement what you have just learned. Your mind, your body, your soul, and your future you will thank you for it. These discussions are only available to view for 24 hours, but if you would like to get lifetime access to re-listen, relearn, and share with your loved ones, then click the VIP upgrade button on your screen. Not only will you receive lifetime access to the event, but you will also get your hands on a private one-on-one Thriving Life creation session with me, Stephanie. You will receive 1 year free subscription to my Sensations Live online cooking class, where we will show you each month how to create delicious meals the whole family will love in 30 minutes or less. You will receive an anti-inflammatory recipe book so you can begin your healing journey in the kitchen, as well as a copy of my ebook showing you how to overcome bloating, digestive issues, and food sensitivities. You will get instant access to the Healthy Living Blueprint 3-day workshop. You will also receive an exciting vitamin G goodie bag and 10% off when you place your next order. But the best part is that you will receive 1 month free access to my signature wellness mentorship called Health Gap. This program is helping people all around the world to transform their health in a totally unique, fun, and practical way. So go ahead and click the VIP upgrade button on your screen now to get over 5,700 Rand in bonuses.